Hi, my name is Kelsey, and I'm going to point to you some of the bones of the axial skeleton. Up here is the frontal bone. On the sides, on both sides up here, is the parietal bone. Back here is the occipital bone, and you'll find this bony protuberance called the external occipital protuberance, and it's a point for muscle attachment that allows for head movement. Over here is the temporal bone on both sides, and on here you'll find the temporal mandibular joint, and it joins the mandible and the temporal bone together. You'll find the massoid process back here, and you'll find the styloid process. It's the needle-like protuberance inside here. Then there's the external acoustic meatus. It's the little hole here for the ear. And you'll find the squamous part, which is the flat part of the temporal bone. And then inside of the temporal bone, you'll find the petrous part of the temporal bone. And inside here is the middle and the inner ear cavities. There's also the internal acoustic meatus, where the cranial nerves 7 and 8 pass through. Then we have the sphenoid bone. You can see the greater wings through the eye and also on the side of the head here. And on the you'll find the superior orbital fissure. The cranial nerves that control the eye movement pass through there. It's a little opening inside the eye. On the internal part of the sphenoid bone, which we can see inside here, is the lesser wings, and they'd be in this middle cavity here. The lesser wings would be up here, and then the greater wings would be on the major parts on the outside. On the internal view is the optic canal, and the optic nerves pass through there to the eyes, and also the sella turcica, and the pituitary gland sits in there. Next is the ethmoid bone, and you can see just a little bit of the ethmoid bone on the inside of the eye here. Inside of that, you'll find the crista galli, which is the outermost covering for the brain, and it secures the brain into the cranial cavity. And also is the cribriform plate, and that helps to form the roof of the nasal cavities and also the floor of the interior cranial fossa. And it allows for the filaments of the olfactory nerves to pass from the smell receptors of the nasal cavity to the brain. Next, I'm going to talk about sutures. This first suture is the coronal, and it is it's right here between the frontal bone and the two parietal bones. And then we have the sagittal bone, and it runs between the two parietal bones. And then there is the lambdoid, which is back here, and it's between the two parietal bones and the occipital bone right here. And the squamous is between the temporal bone and the parietal bone, and it's right here. So then we have the facial bones. So the maxilla and the alveolar process is at the bottom of the maxilla and the top of the mandible, right there. Then there's the nasal bone, which is here. The zygomatic, which are the cheekbones, and the two bones that form the zygomatic arch are the zygomatic process and the zygomatic bone. And we have the ethmoid, which you can see in the corner of the eye over here. And then there's the vomer, and the two bones that form this are the sphenoid and the ethmoid. Then there's the inferior nasal concha, and it forms part of the lateral wall of the nasal cavity. And then we have the mandible right here, which is the chin. The body of the mandible is this part right here. And then there's the angle where the mandible curves up. And then there's the ramus, which is the back right here. And then you have the mandibular condyle where it attaches to the temporal bone, and the notch, which is here, the little dip, and then at the front of the dip is the coronoid process. So, and then we're going to go to the vertebral column, which we have 4 curves in our back. The first is the cervical, which is concave, and the thoracic, which is convex, and then the lumbar, which is concave, and the sacral, which is convex. And the thoracic and the sacral are primary, and the cervical and the lumbar are secondary. So the first is the cervical vertebrae, which there are 7 of them. And here's the atlas up here, which is the top one. And it articulates with the occipital condyle. And the demonstration that this joint does in my own body is it can help us to nod yes. What's unique about the transverse process of the cervical vertebrae is that it's a site for muscle attachment that allows for movement of the vertebral column and for the ligaments used to stabilize the vertebral column. And compared to those in the thoracic and the lumbar vertebrae, the thoracic and the lumbar vertebrae articulate with ribs or correspond with the ribs. So next we're going to talk about the thoracic vertebrae. There's 12 of them, and the spinal process is the backs of the parts that stick out, and then the transverse process is so the transverse processes are the sides of it, and then we have the intervertebral foramen, and those are little gaps that you can see from the side. The spinal nerves from the spinal cord pass through there. We have the body of the centrum, which is the main part in the front of the vertebrae. Inside it is the main part. And then the position of the intervertebral discs, which is the spaces in between. So we have 5 lumbar vertebrae in the back, and we have the sacrum down here, and that is 5 bones that are fused together. At the very bottom of the vertebral column we have the coccyx back here. So in the front we have the sternum, and the top of the sternum is called the manubrium. The middle is the body. Over here underneath is the xiphoid process, and the very top is the jugular notch. For our ribs, we have the vertebrosternal, or the true ribs, and they are these right here, the ones that have their own cartilage. And then under that we have the false ribs, or the vertebral chondral right here, down here, these ones. And underneath, down here, we have the floating ribs. So the head of the rib is actually in the back, and it's the part that touches the vertebrae. And then we have the neck, which is this part in between, like a little part in between, and then the tubercular, which is a little notch. And how the ribs articulate with the vertebrae is that the head of the rib articulates with the demifacet of the vertebral column, and the tubercle of the rib articulates with the costal facet.